You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. With us, we have San Diego's cosmetic dentist, Dr. Mary Walsh-Cole. Dr. Walsh, welcome to the program.
Thank you, Randy. It's nice to be here again.
Okay, now it's Dr. Walsh-Cole, but your patients call you Dr. Walsh. Is that right?
That's correct.
All right.
Yes.
Now we've had you on the program before. Always a pleasure. You brought some new before and after photos.
I did.
Now, for those that don't know you, tell us a little bit about your practice. What kind of patients do you see?
I see people from all walks of life.
All right.
I have patients that are very successful business people, CEOs of companies, administrative assistants. I have college students. I have
So
retired
it's becoming
people.
very mainstream now, cosmetic dentistry?
Yes, cosmetic dentistry is accepted by people of all ages. Families that want their children to have the best smiles that they could possibly have will invest in whitening, braces, maybe some veneers for their teenagers before they head off to college.
Now, I like what you say, that in a down economy or any economy, that the safest investment is yourself. Elaborate on that.
People need to feel their best when they're out looking for a new job. If they've been recently laid off from their position, or they're going back into the workforce to help their family out, or they're older and maybe their investments aren't doing so well.
Okay.
They want to look their best, and such an important part of looking your best is having a great smile, feeling that you look youthful, that you look vibrant, that you look full of life, and we can do that for them with cosmetic dentistry.
Yeah, I mean, on a job interview, and we interview people all of the time, you can't help but look at their teeth. You know, it's a healthy look, it's a young look, it's an energetic look. When somebody's smiling big and not afraid to show their smile, it's almost a positive attitude look.
That is so right on with what's happening in today's world. I have so many patients who come in just wanting to know what I can do to help them look better. I do smile makeovers all the time for women that are middle-aged, that might be going back out into the workforce. Maybe they're recently divorced, widowed, who knows what the reason might be, but they need to look younger. They need to feel better about themselves. I have retired people who are moving into the area, moving into our beautiful coastal retirement communities, and they want to look their best.
Now, on the consult, I mean, is it usually an occasion that makes them want to change their smile? I mean, do they tell you, like a wedding? You mentioned some of
All
these
of those are great reasons. Some people will come in when they're going to have a wedding in their family, their daughters may be getting married, and their new smile is just part of what they want to do to look their best for that important day. It might be their own wedding. There's second, third marriages that occur that a woman or a gentleman wants to look their best for that special day.
Do they tell you this on the consult? I mean, kind of tell you how their smile really, like they don't like their smile?
Usually we have an information sheet to get an idea of what they're looking for. Do I want my teeth whiter? Am I looking for a broader smile? Do I think my teeth are too small? What is it that they don't like about their smile? And then that just leads us in to ask the appropriate questions so that I can individualize their treatment plan. If it's the fact that they don't like gaps between their teeth, they don't like the fact that they're dingy and dark teeth, all of those things are taken into consideration when I treatment plan.
Now, you know, before we came on, and I know you're one of the busiest cosmetic dentists in all of San Diego, and I said, why is it? Why do you think it is? And you hate to brag about yourself, but you know, I mean, why is it?
Well, I'm long established in Encinitas. I've had my practice there for 25 years. I have well-established contacts with colleagues in the area that refer to me. I have joined many professional organizations and taken a lot of continuing education courses, which have given me the reputation for being the go-to person for cosmetic needs.
San Diego's cosmetic dentist. There's a ring to that for sure. And now, after dental school, I mean, is this true that they don't teach you a whole lot of, you know, a whole lot about veneers or cosmetic dentistry in dental school? And what training have you had after dental school?
Well, I graduated from dental school in 1980 from Tufts University in Boston, and I did a one-year general practice residency at USC afterwards, and then shortly after associating for a few years, I established my own practice in Encinitas in 1984. Maybe dental school has changed a little bit now, but the things that I'm doing now didn't exist when I graduated from dental school.
Really?
So in the past 30 years, I've taken thousands of hours of continuing education to better myself, to learn the newest techniques and to make sure that I can provide the best that dentistry has to offer. Dental school teaches you the basics. You need to learn the rest on your own. And I have received both my fellowship and my mastership in the Academy of General Dentistry, and that included hundreds of hours of both lecture courses and hands-on courses to learn all phases of dentistry. And then more recently, I started attending classes at the Las Vegas Institute for Advanced Dental Studies, which I consider the premier institution for postgraduate cosmetic education.
Huge place. I've been there. I visited the grounds. I mean, I guess dentists from all over the world go to this LVI. Is that right? LVI.
Absolutely.
And learn about cosmetic dentistry.
Yes. Dr. Bill Dickerson, the head of LVI, has really created a phenomenal learning environment for dentists and for their teams. I've not only gone by myself, but I've taken my hygienist, my office manager, and my assistants to learn all the things that we can do as a team to provide the very best experience that you can have.
Respectfully, I say, though, it seems hard to believe that there's that much to it to create this great smile. That you need all this training. It seems like you're putting veneers on teeth and.
You want to know that the person that's doing your dentistry has experience.
Okay.
You want to see cases that they've done, not things that they're showing you pictures out of a book that somebody else did. You want to know that they have the skill to be able to design your smile appropriately for your age and for the shape of your face, for the shape of your lips.
So custom smile design.
That's right.
Is that right? Is that real?
Obviously, not everyone has received that training, and I have patients who come in with so-called cosmetic dentistry in their mouths, which I think
so-called cosmetic dentistry. Okay, I like that.
I think it's atrocious.
Wow.
And
you know, we have dentists, you know, or doctors for that matter, that fly in from all over the country. We're all over Canada, and I see a lot of photos. I looked at your photos, and I really am trying not to endorse you on this program, but those are some of the best photos I've ever seen. So there definitely is an art to it and a science. But when I can see veneers from across the room, and I could spot them, they're big, they're bulky, like a horse. Are you saying that's in the hands of the dentist 100% of the time? What is it?
the majority of the time it is.
Okay.
Sometimes the patient will put certain restrictions on what they'll let you do.
They like big teeth.
Or they tell you that they don't want you to cut anything down on their teeth. Well, you can't give a natural look by adding bulk to the teeth. Sometimes some patients are candidates for very, very ultra-thin veneers, but if you're trying to change the gaps between teeth or you're trying to make the teeth straighter, you need to be allowed to remove some of the tooth structure in order to give them that ideal smile that they're looking for.
How long will they last? I mean, these will last a long time. They don't fall off, those kind of things?
Veneers that are well done and with a patient that's been educated how to take care of them, they can last for many, many years. There are people who have veneers in their mouth that are 18 to 20 years old. Veneers didn't exist much longer than that. So I learned to do veneers at some continuing education courses at USC in the early 80s. That was when they were on it was breaking news at that time because bonding had just come about. And bonded resins are what gave us the ability to bond porcelain to teeth. So that was the cutting edge technology at that time. Right now, we've just perfected the types of porcelain that we can use, the natural translucency that can be built in.
You say it changes people's lives, though. Really. I mean, you change their teeth, you change their life. I mean, it sounds a bit of an exaggeration. Now, maybe because I've had, these are my own teeth. I take it for granted.
Well, obviously, I see it every day in my practice. I have done veneers on teenagers who are so excited about just having minor changes done on their teeth that they're going to have their senior picture taken, and they're so excited that they're going to have these beautiful white teeth for their senior picture. I've done full mouth rehabilitations on middle-aged, successful businessmen and women who just want to look better. For some people, it might be a comment made by a grandchild that, "You've got really dark yellow teeth, Grandpa. Why don't you do something about them?"
But you say teeth can hold you back.
If you don't have the self-esteem to want to feel good about yourself and you don't feel good about yourself, you're not smiling, you're not showing confidence, that will hold you back.
All right.
You might not get that job. You might not meet that new person in your life.
Are some people really, really consumed with how much they don't like their smile? Where you have to force them to smile in your office?
There are patients who come in, they'll keep their hand over their mouth.
Even to you,
won't
though?
Smile. Yes, Yes, it happens in our office
Interesting.
too. We also have patients that are fearful that the reason they might not have done anything about their teeth is because they're extremely fearful
Yeah.
of coming to the dentist. And if they have stayed away for 25 years, they're going to be embarrassed of how bad their teeth look.